Good afternoon, good morning, good evening, everybody. Welcome back to another episode of the Global Health Uncensored podcast. In today's episode, we have a highly respected global health leader who currently serves as a vice president of global health strategy at the United Nations Foundation. Um, he has over 28 years of experience in public health. He has played pivotal roles in shaping Africa's health security, particularly during his time at the Africa CDC as the acting director for Africa CDC. Um, he has been instrumental in advocating for Africa's new public health order, and his expertise spans health diplomacy, policy formulation, and pandemic preparedness. So we are incredibly honored to have Dr. Ahmed Ogwell join us today for our episode. Dr. Ahmed, thank you so much for joining us. It's been a long time trying to plan for this. I know how busy you are. We are very grateful that you are able to join us today.
It's my pleasure, and thank you for having me.
Sure. So I want us to. I always like to start from the storyline where your journey began. So for you, what would you tell us about your early um, life and how you eventually ended up in public health?
No, thanks. Early life. I grew up in the lovely coastal city of Mombasa. That's where I was born and bred, in Kenya.
Mm-hmm.
And a very normal childhood, if you want, living in an informal setup where we met and interacted with nature, including disease, on a very regular basis. My father was a sailor, not full-time, but he was a sailor. And I say not full-time because he operated a rescue boat. When ship are in trouble, then they will go out and fix whatever needed to be fixed, and they come back to shore. So I grew up in Mombasa, and two things really shaped my journey into public health. One is when I was very young, I must have been 5, 6 years old, I got very sick. And it was a big struggle to try and get me well. And my mother and father, they tried everything they could, including back to the village, trying some traditional medication. Eventually, I got well. When I went back to Mombasa, I told my mother that, I want to be a doctor so that I can be able to help other people who are going to get sick the way I was. Sick. So this was very much a decision made when I was very young that I wanted to be a doctor. And of course, the folks around my family never let me forget that. Every time they will remind me that you need to do well in school because you said you want to be a doctor. Yeah. So I did well in school. Now, later on in life, when it was time now to try and define what do you do with yourself. And there was the option of either becoming a surgeon full-time or going into something different. Something different was actually public health. And one of my lecturers then, Professor Chindia, an old, very graceful man now, he said something very telling. He said, if you want to, because he was a surgeon, if you want to be a surgeon, you'll spend your life here. We were in theater at that time. 2 a.m. in the morning trying to fix accident victims. He said, this is where you'll spend your life.
Yeah.
Public health, on the other hand, you'll spend your life outside. Mm-hmm. And I went to a conference, it was in Dar es Salaam in Tanzania, interacted with some public health names of the time, and I got convinced that no, I don't want to be in theater throughout. I would rather I was outside. And by that engagement in during that conference, I got to secure a scholarship to go and study in Norway
Okay.
at the Center for International Health in Bergen. And when I got that scholarship and I went back to my station, I was working with the government. I also found that I had been approved to also do a Master of Public Health at the University of Nairobi. So I did
Mm-hmm.
my Master in Public Health at the University of Nairobi in 1998 to 2000. And as soon as I finished that one, I then took up the Master of Philosophy scholarship to go to Norway, and I did that as well. When I came back, I walked straight into public health. So these two telling, milestones, if you want, shaped my path first into the medical field and then eventually into public health.
Into public health, yeah. I think like most physicians have that kind of the aha moment where they decide that no, this sitting in the consulting rooms for the rest of my life is not something that I truly want to do. But in I know in my situation and I hopefully in most African physicians, when you're trying to move away from the clinical field, you tend to have some hurdles, even from your own family. They'll be saying, we paid all the fees for you to become a doctor. Now you don't want to see patients again. So, in your case, what were some of the biggest hurdles you faced during that transition from clinical practice to public health?
Yeah, no, that is always it's a community generated problem
Yeah.
that we can no longer be able to come. In fact, when I did public health, it was pretty much within my family. It was my wife and children. But as soon as when then I went out to Norway, when I was coming back, the community were expecting that I come back and I would be this big shot doctor doing big things
Yeah.
of the clinical type. But then I came back and Professor Odhiambo, a cardiothoracic surgeon, very distinguished senior citizen now, we were together in a committee for tobacco control.
Okay.
And he said, now that you're out there, I used to do that before I left. Then when I came back, before I came back, he did send me a message. He said, now that you're out there, when you come back, come and do tobacco control full time at the Ministry of Health. Because when I was going for my master's in public health, I was working at the provincial level.
Okay.
And then he said, look, there is a gap and there is need for someone to run tobacco control at the national government level.
Mm-hmm.
I wasn't too keen to go to the national government, but he was very persistent.
Mm-hmm.
And I came back. I took I think it was 6 weeks leave as you integrate back. But it didn't take 6 weeks. Within 2 weeks, he had held my hand. He took me to the director of medical services at the time and said, here is the person who's going to sort out the tobacco control issues. And on top of that, he will do non-communicable diseases. And so the two senior colleagues made that agreement, and I was asked to report the following week. So I came as the head of non-communicable diseases at the Ministry of Health. Now, my community, the larger family, were expecting I would be in the clinic, but then I said I was going to be at the ministry. And you know how our governments are known for
Yeah.
things that are not very straight. And they said, but why would you, you've gone, you have read, you have come back, why would you go to the ministry? Come out here and do real work. In fact, earn real money, not civil servant salary.
Yeah.
And me and my colleagues had a clinic which still runs until today, thankfully. So after work, that's where I would go and do a little bit of this and that. But it was stressful doing clinical work and at the same time doing government work. And
Government. Yeah.
as I became more established within the ministry, it became very difficult to go and do that work. So I stayed at the ministry full time. But the community were not very happy that you come and then you are sitting behind a desk. So I told them, look, I will help you and I will support wherever I am. It will still be me, and I can be able to provide that support. In any case, I can't treat you because you're family, I will always be able to find someone
Yeah, to help
I
you.
can treat you. The second thing is when um, I went to the ministry, I was the youngest head of a department. And you sit amongst very senior people. So there was, I wouldn't call it discrimination, but there was pressure of um, being the youngest.
Hmm.
And there was also pressure of, I want to do things a little bit differently. And yet there was this established way of civil servants behaving, which I didn't want to do. I wanted to do things different. So there was pressure from outside and there was pressure from inside. How I was going to be running the Department of Non-Communicable Diseases. But long story short, these two pieces of pressure, I think, shaped my desire to do things right within the public health space, to do things right within the civil service, to do things right within the public arena. And it has stayed with me throughout my career in public health.
Yeah, that's uh, uh, that's exactly how a lot of people feel. So I know you've been stationed currently in Washington D.C. How has that experience been so far, working as a uh, uh, vice president for global health strategies at the United Nations Foundation?
It's a different role from what I was doing before at Africa CDC. Africa CDC, it was pressure. You are working 24/7, chasing emergencies all the time. At the UN Foundation, we do a lot of resource mobilization and advocacy in the background,
Okay.
which is a very good transition for me in the sense that while before I was receiving resources and going to the ground, right now I am behind the scene mobilizing resources so that those who are going to the ground can have what they need. And
Okay.
with the experience from being on the ground, it becomes easier to appreciate and even advocate for some of the resources that we then make available to the UN agencies to do the life-saving work that they are doing. So it is different, and I think in as far as transition is concerned, it fits in well with the more progression you make, then you want to do less emergency things and more strategy, policy, diplomacy, and resource mobilization.
Okay. All right.
It's a lot slower, let me say, than what I was doing before. But I'm very happy with it because I think it is that time also to be able to give back, mentor others, and mentoring others when you're chasing pathogens and disease emergencies is very difficult.
It's
But
difficult.
then,
That's true.
yeah, when you're when you're a little bit when you have a little bit of time on your hands
Hmm.
over the weekends, you can be able to mentor others and contribute to the growth of younger public health
Yeah.
professionals across the world.
Yeah. I think that is extremely important, especially looking at where we all come from and the kind of gap that currently exists in the public
Yeah.
health space. I know one of the areas that you are very passionate about is health security, pandemic preparedness, and challenges that uh, Africa public health faces. Um, Given your experience leading the Africa CDC through the COVID-19 pandemic, um, what has been some of the critical gaps in pandemic preparedness that you think need urgent attention, both especially in Africa and globally?
Um, there are quite a number of key gaps in
Hmm.
pandemic preparedness, and let me share three of them. And not an exhaustive list, and not in any order, not in any order of importance. The first is the appreciation
Hmm.
of the strength of working together, whether you are a neighbor nearby or you are a neighbor far. These days with air travel, someone can be very far away from you and their neighbors because there's so much communication between the two countries.
Yeah.
So that appreciation of the value, the importance, the critical need for different jurisdictions to work together is a gap because whenever there is an emergency, people tend to do things on their own rather than things together. So if there was one thing that I would provide as advice, it is work together, because the burden becomes lighter, whether it is communities, whether it is professionals, whether it is different parts of the same government, whether it is different sectors, different countries, different regions, different continents. When you work together, you lighten the load, because experiences are different, skills are different, and also the environment in which a disease outbreak is occurring is also different. So this is one big gap that I see. The second is what I would call sharing. We don't share enough, whether it is experience, whether it is tools, whether it is money, whether it is data.
Yeah.
We don't share enough. And in pandemic preparedness and response, you can't have it all by yourself. Someone else will have a portion and they need to share with you as you share with them the portion that you have. So the sharing of these different aspects of response is still not at the level that it should be. And if you look at the negotiations today of the pandemic accord, you see the tension that there is
Yeah.
when it comes to sharing discussions. Whether you want to share the pathogen itself, or you want to share the tools, or you want to share the products, whether it is vaccines or the test kits, the sharing part is still not solid. So it is a very big gap.
Yeah.
Finally, finally is the gap of capacity building. You find that one part of the world has a lot of capacity, while the other part has very little, if at all.
Yeah.
And the sharing of that capacity needs to happen before the emergency comes, so that when the emergency comes, there is basic capacity to be able to quickly respond. But then you find some part of the world just don't have the capacity at all. And another part of the world has more than enough of it, and that is not, that capacity is actually not being made available where it is required. For example, even on the continent, amongst the different countries, you find the same thing. If you look at Africa, if you go to Asia, for example, you'll find the same thing. Between countries, there are differences.
Yeah.
Now, if we combine those three gaps, the neighborliness, the making available tools, and then making available capacities, then you'll find your preparedness and response becomes better than if you're just doing it on your own, however much resource you may have. So these three gaps, I think, if they were addressed, we will be tackling issues around pandemic preparedness and response in a more effective way.
Yeah, yeah. I think you've highlighted very critical areas that needs urgent attention, especially on the African continent. And I think one other issue that in terms of the sharing and collaborating with each other, I think one thing that we are lacking is the platform to make it easier to share, right? So until we are able to take advantage of emerging technology and really build a seamless a platform that helps with seamless data sharing whilst ensuring privacy, it's going to be a very uphill battle. And the issue of equity or global solidarity, it's also very, very crucial. And I don't know how we can overcome that, because people tend to be more nationalistic than necessary. And until we are able to sort these things out, global health security will still be at a level where can really be compromised.
If I may just interject there,
Yeah.
the human being is designed for self-preservation.
Mm-hmm.
So when there is danger, they protect themselves.
Yeah.
And that's exactly how we see countries behaving, that when there is danger of a large outbreak, they tend to protect, everyone tends to protect themselves. I'll protect myself, you'll protect yourself. Country A will protect itself, the same with country B. So to address that, we need a mechanism, and you're very right, the platforms need to be in place before there is danger.
Yes.
So that when there is danger, instead of us reacting to protect ourselves, we put the systems in place, the mechanisms we've already agreed. Then those are going to address our reflex of just wanting to protect ourselves, because those mechanisms will kick in and will protect everybody. But if we don't put the mechanisms in place during peace times, we can't be able to put it in place when there's actual danger, because
Yeah.
our nature will be to protect ourselves.
Yeah, I think that is a fair point. And I know, like, we've gone through a major pandemic. You are at the forefront of COVID-19. Um, what sometimes I still think that we especially not even Africa alone, it seems like we haven't learned a lot of lessons from COVID-19, the COVID-19 pandemic. And if you were to summarize some of the valuable lessons that we should learn that should potentially shape the future of global health security, what lessons would you say we should have learned by now?
Let me share two very important lessons that we truly need, and now that we have Mpox outbreaks, truly need to put those in place. The first is we need a platform for decision making,
Mm-hmm.
where those who are the, have the authority to make decisions meet, they make a decision and it is implemented. You don't start with this of 100 meetings before a decision is made. And this lesson we learned during COVID, when the continent of Africa, the heads of state, President Ramaphosa of South Africa was chair of the African Union at that time, they decided they're going to meet regularly, the heads of state.
Yeah.
And during each meeting, Africa CDC will be asked to present the challenges the continent is facing, and then we will be asked to make a proposal on what needs to be done. And most of the times, the heads of state will say that decision is made, go ahead and do it. Whether it was money that was required, it was travel that was required, it was infrastructure like labs that were required. The decisions were being made and implementation was happening. So that platform is a big lesson that we need it at the global level as well. It doesn't have to be heads of states, but it needs to be individuals who have the capacity to make decisions on resources. And that decision is made and implementation begins immediately. You don't have to go through 10 rounds of meetings. This is one very important lesson that we learned. Second, a lesson that we learned is that when we share expertise, we share infrastructure, we share capacity, we share resources, we arrest the process faster.
Yeah.
When we keep the resources to ourselves, it takes longer to be able to reach the desired goal. So what Africa CDC's role then was, and very critical role, was collect resources and then distribute them as per need. And that ensured that the test kits were going to the right places. That ensured that experts from across Africa were going to the right places. That ensured that when money was raised, it was being used in the places that needed it the most. It ensured then that the numbers were lower, the number of deaths, the number of affected were much lower. And second, it ensured that each and every country was playing its rightful role in the continental response. And that translates also to the community level. When you distribute these responsibilities, you know who is doing what, then you are more likely to succeed than when it's only one group that has all the resources and the rest then do not have. So these two things for me are very important lessons that we can be able to utilize in any outbreak, in any health emergency, in any disease threat.
Yeah, yeah. So you've also highlighted the element of interagency collaboration. If I may ask, I know recently getting involved with WHO Afro, it's I often ask myself how closely has the Africa CDC and other um, international agencies on the African continent, how closely do they work together? And do you think there's still room for improvement in terms of joint projects or initiatives that can all be geared towards improving public health outcomes on the continent?
And drawing again from the experience we had during COVID and Ebola and Marburg, cholera, very big outbreaks that I was involved in my time at Africa CDC. The key is not the number
Mm-hmm.
of institutions, the key is the quality of coordination.
Yes.
And that quality of coordination, when it is present, it builds trust. And when trust is there, then everyone plays their part and their role in an easy way, knowing that when the end of the day comes, everyone has a portion that they can show that this is what we did as an institution, this is what we did as individuals. So the quality of coordination is the key, which leads to trust, and that trust will then lead to the ease of working together. So there are many players on the continent of Africa who come into the response activities. And within a country, the government usually has the responsibility of coordinating all the players. And at the continental level, all the continental institutions, whether it is the Africa Union, whether it's Africa CDC, whether it is WHO, the continental institutions need to come up with a mechanism for good coordination. And when that quality of mechanism is clear, then you find work is a lot easier. The numbers for me are not as important as the quality of coordination, because then everybody is playing their role and playing their part. Africa needs a lot of that because there are many players within the space of public health and especially health security.
Yeah. So recently, or a couple of weeks or months ago, both the Africa CDC and the WHO declared monkeypox as a public health emergency of continental security or international concern. Um, what are some of the key measures that you think countries should prioritize in order to contain the spread of or the current spread of Mpox?
So if you look at the way Mpox is spread,
Mm-hmm.
especially human to human touch, well, let's focus on that. It is by close touch.
Yes.
And so it means the speed at which it spreads is much lower than if something is airborne,
Yeah.
because you have to really be in touch with someone or have contact with their bodily fluids in clothing or different surfaces. In this way, it allows us to be able to use public health measures. And we have different tools in public health. And if we use those effectively, we can be able to bring the Mpox outbreak under control. Many times we talk about the vaccine, but the vaccine is only one.
Yes.
And for me, the key things that countries, institutions need to be doing right now to address the issue of Mpox, one is proper diagnosis.
Mm-hmm.
Let our health workers have enough information so that their index of suspicion is high enough to be able to pick out these cases before they go and spread within the communities. Second is laboratory testing capacity.
Yeah.
And right now we only have PCR to make laboratory confirmation. We don't have rapid diagnostic kits.
Mm-hmm.
This is an area that could be able to be grown, and our scientists should be able to come up with rapid tests so that we can do the testing in the community rather than take samples and then take it to the central lab, and that takes time to be able to run one test. So testing to know your burden and to be able to map out where the cases are is very key. The third thing is information, particularly to the community. Then they know what they're dealing with, how to protect themselves from it, and how they can be able to secure safely someone who has that illness. When this
Yeah.
information is made available, stigma drops, and management, proper management of cases then increases. And when the members of the public have been given the information, they are also going to be your first point of identifying where the cases may be. So your
Mhm.
surveillance system becomes includes the community in it. The fourth is vaccines. And vaccines are used based on the burden, which now, if you have a good surveillance system, we know where it is.
Yeah.
And vaccines are also used based on the profiles of of the individuals who need to be vaccinated. And of course, usually you want to start with the health workers who deal with these cases regularly, so that they're better protected. And then you go into the communities where this Mpox will be circulating. So we need to use the full range of public health tools in a community for us to be able to bring this under control. Remember, we have had Mpox on the continent of Africa since the late 60s when it
Yes.
was characterized. So we know what we are dealing with. And right now, what we need to do is just put these tools, the public health tools, into play in an aggressive manner, particularly in the areas where the infection is spreading, and we'll be able to arrest it. The key is the community. If they know what they need to do and they're motivated to do it, then we will stop the outbreak.
Yeah, and as you rightly said, this is not the first time we're having an mpox outbreak. We've been having series of outbreaks, and there are other emerging um, zoonotic diseases that are also coming up.
Mm.
Um, what are your thoughts on how we can strengthen global health frameworks or global frameworks for pandemic preparedness?
Um, Today, the only method of doing that is through negotiation,
Yeah.
because every individual country must be part of that process. Um, to do that, we need um, to ensure that countries see themselves as part of the solution,
Mm-hmm.
not a negotiation which is lopsided, where some countries feel that they're being, the weight is being put on them and their interests are not being included in the framework. So when we have a situation where countries feel they are part of the elements contributing to the framework's content, then they feel more ownership for those frameworks, and even implementing them is going to be a lot easier. So we need to check during the negotiations, are we taking the path of pushing different countries into a corner with um, uh, the when a country has fewer has less capacity,
Mm-hmm.
and then another country has more capacity, the one with the less capacity may feel that they've been pushed into a corner. But when ideas are put on the table and the countries with the less capacity feel that they are part of the process, then these frameworks are going to look better. They are
Yeah.
going to be more easily implemented. For me, the content is important, but more important is how we reach that content. And when countries feel that they are part of the process, and we need to encourage countries to be fully engaged, when they feel they are part of the process, that resulting framework is going to most likely be implemented and therefore achieve its objective. So if there was one thing that was to be done, it is to make sure that each and every country is part and they feel part of the process.
Yes, yes, and I think that this is one area that has gathered a lot of talks and arguments about how global health is there isn't any equity in global health, whether it's in global health leadership or global
Yeah.
health decision making. or how the global north sees experts from the global south, and how easy it is for even experts from the south to get involved in decision making in terms of traveling and all those things. All these are heavy barriers to making sure that our voices are heard in the global space.
It takes resources. It takes resources to be able to engage. And when the country feels that they're investing in something that they are part of, then they will invest in it. But they
Yes.
need to be part of the process. Fully agree.
Yeah.
Yeah.
So I know we also we keep talking about capacity building.
Mm.
Nurturing the next generation of public health professionals. In your role, both at the Africa CDC and currently with the UN Foundation, what strategies have you found most effective in mentoring young professionals, particularly those from underrepresented regions?
For me, the most effective way is including them in the process, so that they can practice public health and they can also contribute to the strategies and leadership within public health. Make the young people part of the process. And that means mentoring them within the space of their doing what leadership entails, they are doing what public health entails, they are doing what health security entails. When we make them part and parcel of that process of leadership and technical activity in as far as health security is concerned, they come out on the other side very well rounded
Yeah.
because they have seen it, they have been doing it with the support of someone who's more experienced. And when they are given responsibility after this season of mentoring, they certainly are more likely to be good public health leaders. And this is my approach towards encouraging young people to be part and parcel of public health leadership globally.
Okay. So in terms of leadership or leading in a public health space, what advice would you provide to emerging public health leaders or young professionals who are aspiring to be public health leaders? What are some of the effective um, skills you would say that are very crucial for them to learn from the beginning?
Several steps. One is I will encourage them to, public health is very contextual. It is context specific.
Mm-hmm.
The public health I will practice and lead in one place is very different from in another place because the contexts are different.
Yeah.
So one thing I would encourage young people to do is understand the context of public health within your space, whether it is at subnational, national, or international level. What is the context
Mm-hmm.
of that particular area of work? When you understand the context, then you're able to contribute much better. Second is learn from those who are doing the leading
Mm-hmm.
at that time.
Yeah.
So if Banda is in a position of responsibility, you shadow him and get to see how he or she solves and addresses issues in your context and where leadership is required. So learn from those who are actually doing it. And of course, even when you learn from me, you'll see the good I do and you'll also see the bad that I do. So you learn from both sides. Then three is be engaged in those activities. You can't lead when you are doing it from far.
Yeah.
You have to be right in the middle of what needs to be done so that you are an effective leader and you're an effective professional. So they must be part and parcel of what is happening rather than doing it from a distance. These are the three things that I would really encourage them to do in as far as public health and public health leadership is concerned.
Okay, okay. So I know we've been speaking for a while. I want us to explore a segment that is a bit fun. I know you're from Kenya, but hopefully you've tried other African foods. So in terms of dish, what is your favorite dish in when you're away from home. Now that you're away from home, what is your favorite dish?
Fish will always be number one.
Okay.
Fish, especially when it is grilled with very little soup, not too much soup, but grilled
Okay.
fish. This will always be number one.
Okay. Okay. How about if you go back to Kenya,
Yeah.
what is your number one uh diet that you'd always crave for?
Oh, I love when I'm back home. I love liver.
Okay.
I love liver. I don't know whether you know the dish called chapati. It's round. It's like naan.
Okay. Yes. Yes.
Yes.
Yes.
So there's one specific one we call chapati back home in Kenya. Very famous along the coast, the Eastern Africa coast. So that
Okay.
chapati and liver, these are my favorite dishes.
Okay. Okay. Yeah. Yeah. I think I've had conversation with a few people from Kenya, and most of them would mention ugali or something
Yeah.
like that. I
Yes.
think it's also quite common.
It
Have you
is.
had the opportunity to try any dish from Nigeria and Ghana?
Oh yes, yes, yes. No, I don't want to get into the fight of the jollof rice from both places, but for Nigeria,
Uh-huh.
actually, the thing that I like the most is suya.
Okay. Mm-hmm.
Yes, yes, suya. This is the grilled street food.
Meat. Yes.
This,
Yes.
yeah, the grilled meat or chicken. This I really like. But when it comes to to the fight between, but jollof will always be the number one go-to food when you're in that West African part
Yes. Yes.
of, of the continent. Yeah,
Anyway, okay, good to know.
yeah.
So if you are not working in the public health space, which career would you pursue, or which
If I
surgical field? I know you would have been in the
no,
surgical area.
if I was not in health at all, I would
Uh
most
huh.
probably be in law.
Okay.
Most probably I will be in law. If I was not in public health, for sure I will be doing surgery somewhere. But I think I picked the right choice, and I'm in
Yes.
public health.
Anyway,
Yeah.
what's the best piece of advice you've ever received?
The best piece of advice I've received is, if it doesn't concern you, leave it alone. We
Okay.
spend so much time focusing on things that actually don't concern us.
Yeah.
And we consume a lot of time from things that we should have been focusing on. So that's the
Hmm.
best piece of advice. If it
Yeah.
doesn't concern you, leave it alone.
Yeah, that's true. Don't waste your energy.
Yeah.
What would you say? I know you may have a lot, but what is one of the most proudest moments in your professional journey?
Wow. Yeah, there are quite a few. But I think one that really sticks out is the control of Ebola in Uganda in 2022.
Okay.
We did that in within 70 days. And that was a very proud moment for me, for a country with not so much resource,
Hmm.
for a very complex outbreak, the way that the government coordinated the partners to work together, the role that Africa CDC at that time played. A very proud moment for me as a professional to see public health working, and the results you see them in a very short time within 70 days,
Yeah.
69 to be precise.
Wow. Wow. That must have felt really good. Um, Last question on this segment is, what's one thing that people would be surprised to learn about you?
My goodness, I have absolutely no idea. Maybe one thing that people will be surprised is I stopped playing, but I played the saxophone.
Okay.
As a Muslim, we are very far from music,
Mm-hmm.
but
Yeah.
at some point in my life, I actually learned to play the saxophone, and that would be quite a surprise. I no longer play it, but If there was an emergency, yes, that is how I used to play the saxophone. Yes.
Awesome, awesome, awesome.
Yeah.
Well, I think we've come to the end of our episode. It's been incredibly insightful, and I've learned so much from this conversation. But before you go, what advice would you offer? I know we've spoken about this already. What your final advice to early career professionals? Graduate students, everybody who is looking up to our leaders in the public health space, and really looking forward to learning from them and also taking the same route as they've done.
My advice will be pick an area of work that you actually like to do. Sometimes we are pushed into careers by other influences, and then we don't really like it, and we end up spending our time doing something that we don't like. Pick an area and a career that you actually like. Second is really learn from those who have been successful, who have tried to do something in that area, learn from them. And then third is, as a young person, don't wait for tomorrow to be effective in that area or to be a leader in that area. Your time is now, and you can be able to lead in a small way, in a big way, but don't wait for tomorrow to lead. Don't wait for tomorrow to be effective. Don't wait for tomorrow to do. Do it now.
Yeah. Thank you so much. Thank you so much. The end message is do it now. You don't have to wait till you gather all the expertise or you gather all the experiences. Experience starts with actually starting now. Thank you so much, Dr. Ahmed, for joining us. I really appreciate your time and your efforts.
It's my pleasure, and looking forward to many more conversations.
Sure.
Thanks a
Hopefully,
lot.
when I come around DC, I'll pass to your office, and then we
Please
can
do.
chat
You're
more.
most welcome.